Now, as Nigeria joins the world to celebrate International Women's Month, stakeholders are advocating for maternal health programs and services that incorporate women's experiences and perspectives to improve the quality of maternal care. Amaka Walker here tells us more.
Her body is a museum of scars, but still she finds a door for him. Her back is a flashback of drunk nights and swollen face.
Elevating women's voices for quality maternal healthcare is the theme for this second edition of the Nigerian Health Watch Celebrating Womanhood Art Gala. Nigeria's maternal mortality rate is still amongst the highest in the world, with an estimated 512 deaths per 100,000 live births. This is nowhere near the SDG targets of 70 per 100,000 live births. Stakeholders here say Nigeria needs to do more to improve the health of women for a better future for the nation.
This particular picture, it's called My Voice, My Health, and it reflects beautifully on the theme of our Celebrating Womanhood events this year, which is elevating women's voices for quality maternal healthcare. And the reason why I like this picture is because it shows, first of all, more than anything, really the beauty of women when they're pregnant. To date, Nigeria has not spent close to 15% of its GDP on health. The budget declaration, heads of states got together and said they will spend at least 15%. Right now, we're just spending just over 5%. What does that mean? When a woman is about to give birth or wants to access healthcare, some of the barriers she actually encounters is finance. If she can't even afford to get to the health facility, when she gets to the health facility, if she has to pay for that health care, these are some of the things that limit her opportunity to get good quality care, but even to seek care in the first place.
And despite efforts by governments to reduce gender inequality, Nigeria still has a long road to go to reduce the number of women dying from childbirth and ravaged by poverty. Affirmative action perhaps remains the surest bet for more women to get politically empowered. But using arts, the resilience of the Nigerian woman is celebrated.
Women generally are the cornerstone of national prosperity, of national health. It all starts with the mother. This is something that we talk about at MST for Mothers. It's called the mom effect. And this is that the story of national prosperity, the story of national health, it all starts with the mother. A mother who has a best chance of survival at childbirth will be alive to look after her children.
I think it's important we remember how amazing women are. There would be no humans if we didn't have women to deliver all these babies in this world. Women are known to be the ones, when you talk about lasting peace, we know if women are sitting at the table, peace are more likely to last. We know that the one to wake up every morning and feed their children is the mother. We know that if the mother is alive, her child is more likely to be educated.
So when women are actually sharing their perspectives and experiences, the people listening to them, we also need more women listening. We also need more women sitting at that table at the policy-making level, the lawmakers who institute those laws that can absolutely lead to positive outcomes. So we are disappointed that we do not have more women, but as a country we have to collectively, first of all, ensure that every single woman's life is worth saving.
My artwork here is trying to correct and solve the mental and moral health of children in the family. If you look at this artwork, you see a happy child, and behind the happy child, you see a mother trying to correct a child. Women should be bold. You know, most times we come from a family, an African culture that tries to suppress the voice of the woman and make the man seen, but that's not supposed to be. Women are supposed to be seen. So I think if a woman begins to be bold and can speak for herself, she would not be abused. She would know when to stay and when to run when there is trouble.
The strength of the Nigerian woman is one that is admired and is worth celebrating.
With sub-Saharan Africa having the highest maternal mortality in the world, Nigeria contributing at least 81,000 deaths to that unfortunate number every year, experts here say, while we celebrate the woman, but Nigeria needs to do more in terms of ensuring that from being a girl child, the girl is educated to help build that resilience for the future, because they say once you educate a girl, you educate a nation. I'm Maka Ude Walker, Arise News.